culturally, we think I have depression, but that's okay because I can take a pill, it'll raise my serotonin, and then I'm okay. And that narrative works if you're one of the people that are helped by meds. But I've also observed in my practice that a lot of people aren't sufficiently helped by meds. And then that narrative ends up generating a lot of hopelessness and despair.
And just like that, we are back. We have got a really special guest. I always get particularly loose, disinhibited, excited, thrilled, expansive, all of the big words when I get another psychiatrist on the podcast. And I have a really special one. We have Dr. Ellen Vora. She is a board certified psychiatrist, but she's a special one, everybody. She's one I've known since she was a medical student. She is also an acupuncturist and a yoga teacher. She is an author of an amazing book, and The Anatomy of Anxiety, which dropped mid-pandemic, thank goodness. She is an individual who takes a functional medicine approach to mental health. She considers the whole person, a very holistic approach, and looks at root causes of what's causing our mental suffering. She received her BA from Yale University. She received her medical degree from Columbia University. And she's in practice in New York City and speaks with audiences worldwide, and has been a good friend and a co-passenger on this journey of being psychiatrist. Ellen Vora, welcome.
Thank you, Drew. I'm doing well. Thanks for having me here. I'm really happy to be in conversation with you.
Oh, I love being in conversation with you. And I think maybe if we can just get it started, can you share a little bit about your journey to becoming a mental health clinician? You're a physician, and out of all the things you can do with that, operate on brains, deliver babies, you and all the other things, you decided to become a psychiatrist. Can you tell us what happened, why that was?
Oh, that whole journey. Well, when I think back to medical school, I was really unmoored. I was not well. I was burned out and depressed and lost and lonely. And I didn't yet know how to navigate the vagaries of life with intuition. I didn't really know how to find my center. Thank God I did wind up in the correct specialty. And it took a couple moments. One moment involved you. That is true. There was some, I don't even remember yet what it was. You were a resident at Columbia. I was a med student at Columbia. And a few psychiatry residents filed in during like a pizza lunch for the med students to ask questions. And I was really trying to analyze, like, are these people I identify with? Are these people that seem happy with their choice of specialty? Do they seem okay? Because you'd see a lot of people file through, and people did really seem really exhausted. I think even all the way to feeling like they were powerless in a broken system. I think that there's moral injury in how some aspects of conventional medicine are practiced. And I was just looking for the wellness. I was looking for someone who felt in alignment. And you were a very memorable light. And you seemed to be someone who had similar interest to me, but you had arrived and you were doing the right thing. I think we had this person in common in our training, this woman named Deborah Cabanis. And she was a teacher that really helped me see a future that sounded good. Because I realized in med school, I was an English major as an undergrad. And then you get to med school and you start learning nephrology. And you're like, where did I go wrong? I'm interested in the vagaries of the human condition and I want to help with it. But somehow acid-base formulae are like not what get my engine running. And so it's really mental health that feels like where we go back to, here's the human experience. Let's navigate those corners of what it means to go through this life and how do we support each other? How can we access a little bit more fulfillment? And so psychiatry was definitely the right specialty for me. Thank God I made it through, even in the cloud of gluten and birth control and not yet having a yoga practice and being so lost and depressed and unmoored and inflamed.
Well, having been a medical student struggling with some of those same feelings, not birth control, and I do okay with the gluten, but in terms of those feelings, I think you had of being within a broken system. I remember being really like mad about ICD-9 codes and kind of feeling like, which someone pulled me aside and was like, you got to pick your battles here, buddy. Like, this is not where you want to start. But there is, I think, a concern, and I hear it now among lots of people in training. How can we really not feel as much like hypocrites? Because if we're going to promote health, we're going to have a system that really prevents illness and helps us promote health. We need to do something different. We need to do something better. We need to at least have a system where our clinicians and medical students aren't constantly burning out. If we can't take care of our own, it doesn't really give a lot of faith to our patients.
Now is the part of the program where we acknowledge that, thank goodness for the heroics of allopathic medicine in reacting to when something has already gone very badly. And it's a beautiful thing that we can fix broken bones, that we can do cardiac catheterization, and so on and so forth. It's just that we're actually pretty mediocre at preventing illness and at taking an illness that is chronic, inflammatory, degenerative, and helping somebody rebalance rather than just adding a very powerful agent that sort of rights one wrong while creating new states of imbalance. And I think that we fail our patients in this way, and we certainly don't know how to do it even for our practitioners. We don't know how to keep doctors well. And it does feel like a deep hypocrisy that we're in the business of health and we don't know how to keep ourselves well.
Ellen, when did you start getting interested in anxiety?
Anxiety is it's the theme of the patients that come into my office. And I'm interested in it in two main ways. And one is that I want to help the people with what they're struggling with. And that was the recurring pattern. But also, I've always thought that when it comes to treating anxiety, we're going about it wrong. And there are some very obvious low-hanging fruit where we're not yet making these simple adjustments to profoundly help people. And so it felt important to me to just add a new voice to the conversation to make sure that we were decreasing human suffering in all the ways that we have access to.
What do you think with anxiety, or some of the low-hanging fruit that a lot of us are missing in terms of taking care of ourselves? I mean, anxiety is I think most folks listening know it's our most common mental health disorder. The number I always see for the last 20 years is 40 million Americans. So I think that number is outdated at this point, but a lot of people struggle with clinical anxiety. When we see that percentage of folks struggling with something on a clinical level, we also know there's lots of people who are sub-threshold. They don't meet all the criteria for panic attack, but you sure have something very close to panic attack and are struggling with it.
Right. So the low-hanging fruit, I think, on the one hand, it's that it's more physical than we realize, and there are simple ways to support our physiology to eliminate unnecessary anxiety. And then there's another aspect of anxiety, which is that some of it is not what we should be pathologizing. It's actually an inner compass really nudging us back into alignment. It's asking of a course correction of us. And this is the central thesis of my book. It's really thinking about anxiety differently than how we were trained. Our Bible is the DSM, and it tells us that we categorize anxiety, whether it's generalized anxiety disorder or panic disorder, with or without agoraphobia. And at a certain point, I realized that was not steering management in my practice in a meaningful way. What ended up being a more useful classification system for me was to divide anxiety into two types: what I call false anxiety and what I call true anxiety. False anxiety, I'll caveat, I realize it's such a triggering term because it can feel so invalidating. The suffering is no less real. The false speaks to the physical underlying basis. So false anxiety is avoidable anxiety. It's anxiety that's based in the physical body. And it occurs when something has tipped our body into a stress response. And that can be a lot of things. It can be a blood sugar crash. It can be a bad night of sleep. It can be an extra cold brew coffee. And when something has tipped our body into a stress response, we often subjectively experience that as anxiety or even panic. And the nice thing is that we can identify the root cause, address it at that level, and eliminate unnecessary suffering. Nobody is served by false anxiety. It's not helping any of us. It's not our deep inner truth. But true anxiety, on the other hand, is purposeful anxiety. It's not something to pathologize. In fact, true anxiety is not what's wrong with us. It's what's right with us when we are able to viscerally connect to what's wrong in the world around us. And that could be in our own personal lives, in our communities, in the world at large. But that's our inner compass nudging us, basically saying, slow down, get still, pay attention, because something is off here. And it's asking us to, it's a call to action. It's show up in some way differently. And once we do, we don't feel quite so mired in that anxiety anymore. We feel imbued with purpose. We're in a state of action. And so I think it's so critical to not pathologize our true anxiety. It's really just the task is to get good at listening to it and honoring the message baked into it.
How do people do a better job sort of differentiating between true anxiety, things we should pay attention to, and false anxiety, things that are causing a physiological response, but they're things that we can prevent?
I'm always doing a dance with patients where I sense if someone's already really paying attention to their true anxiety and they need to give a little bit more energy to false anxiety, or vice versa. But sight unseen, I would say the algorithm is that most of us should start with false anxiety, because to exist in the modern world, we have a lot of states of physiologic imbalance. And I have an inventory. You basically go through it. You figure out, where am I out of balance? And you address it, get things back into a state of balance. And then that clears the air. And when we're still with our physiology pinballing in all these different directions, it's very hard to tune into our true anxiety, because we're a mess. We think that the world is falling apart, or we're in a state of doom and gloom. And it's actually that we're sleep deprived and our blood sugar is crashing. So we can't trust that as our true anxiety while we're still physiologically all over the place. So I have most of my patients start with false anxiety, get to a place of balance. Then you start a practice of tuning into your true anxiety. And that's usually the path for most folks.
I feel like you have a lot of special, integrative, and holistic techniques, between, well, just some of the training you have that a lot of us don't. Acupuncture, I really enjoyed personally as a patient, but and I got a little medical acupuncture training years ago, but it's not something that I get to utilize with patients or feel comfortable with. Same thing with your yoga practice. I love a yoga class, but it's not something that I really incorporate clinically. Can you share a little bit about some of the techniques that you see your patients like foster and grow over time that really help with anxiety?
I love it all so much. And I really came to these practices partly because I was a med student and a resident in crisis. And I felt so out of alignment with what I was being taught. I was kind of very disenchanted. I didn't feel like I was truly helping my patients thrive. I sometimes wondered if I was not doing no harm. And I was myself so unwell. So pursuing training in Chinese medicine and acupuncture and Ayurveda, and becoming a yoga teacher and studying nutrition and functional medicine and eventually psychedelics, all of this really just helped me stay hopeful and feel like I'm actually developing an armamentarium that can genuinely help people. And so what's most helpful? I mean, they're all helpful, and it just depends on the person. Yoga is so interesting in the mental health setting, in that, like, when you look at all of the limbs of yoga, part of that is focused on emotional intelligence. Part of that is focused on social intelligence, how to show up right with others, in truthfulness, in non-harming. It really directly reflects on these things. I find that yoga poses are grounding, and yoga can be this moving meditation. In fact, I really credit my background or my training in being able to be mindful and to be aware of the present moment and maintain equanimity in the face of challenge. I strengthen that muscle in my yoga practice. And that's actually helpful both to convey to patients, but it also helps me in practice, because things can feel so intense sometimes. And I need to find my center and stay clear when I'm with patients. And I draw on those skills from yoga.
It also feels like the whole utilization of the physical body is something that medicine struggled with, other than saying exercise. The notion that there's a whole way of accessing and thinking about our mental health that isn't thinking, that is in our body, that's moving, that's breathing. I mean, it's mattered in there in the kind of integrative mental health world, but it's not really part of how foundationally people clinically address anxiety in a mental health setting.
Yes, we are so disembodied, and we think of mental health from the neck up, that this is where all the action is. But in so many ways, the body is central, both in the sense of what's going on physically in the body is also going on physically in the brain. And good mental health is often a reflection of a healthy brain. Is it inflamed? Are you managing blood sugar appropriately? Are you well slept? Have you resupplied the reservoir of executive function overnight? And all of this, we can't separate from our physical health. But I think there's also something here. Bessel van der Kolk ushered in the new era of appreciating the body keeps the score. And certainly in my yoga practice, I learned firsthand how you might be holding pigeon pose and you're in a deep, long stretch and you're releasing something in your hip, but emotions are coming out. Like you want to cry, memories come forward, a feeling takes over your body. And to me, that's really helpful in practice, because to appreciate that there are parts of our bodies that have a psycho-spiritual component to them. And we sometimes hold our traumas, hold our memories in the physical body. And when I'm faced with a patient who has some kind of physical issue going on, to me, it's always a both and. There's a material physical basis. Like, why is this person's, the thyroid out of balance? Well, because of fluoride in the tap water and molecular mimicry with gluten sprayed with Roundup and so on and so forth. But also, it's the throat chakra. Also, this is associated with communication, with speaking our truth, with receiving communication. And I think it's usually worth investigating if there's a psycho-spiritual component to where we get out of balance, where there's stagnation in the body. And I think yoga really taught me to pay attention to, it's not random where we're physically out of balance.
I think people kind of, I wouldn't say split, but I feel like there's a group, probably a group of people listening who really resonate with the notion of a psychospiritual message and that being part of something like thyroid illness. And I think there are a lot of people in the kind of more conventional world where, that they get a little suspicious of that notion. And I'm wondering how for people listening, how you help people navigate finding maybe like the truth in both of these worlds, or maybe more than the truth, the what's useful to them.
So this is my second book, and I'm still wrestling with these ideas. But here's the thing. The idea of evidence-based medicine, the spirit to that is right. Rather than just a couple of old men being like, arguing by assertion and being like, it's so because I say so, because that's my hunch. We started to speak truth to that power. We said, well, let's put it in a study. Let's test out your hypothesis and see if in fact that's what holds up. It's a beautiful idea. It's corruptible. We are systematically biased in how we evaluate information because of who funds studies and what gets studied, what lends itself to a 6 to 8 week trial, what gets published across the board. And then I think not everything that's real can be measured. And I have a bigger battle to fight right now around, in Chinese medicine, and it's really an ancient Taoist symbol, we have the yin yang, where that yang aspect is sun, masculine energy, doing, action, objectivity, rationality. And that's the part our culture values. That's the part we pay for. That's the part we say, you're right. And that's evidence-based medicine. And then rigorous academic. But there is also the yin aspect, moon, feminine aspect. It's rest, receptivity, surrender, non-doing, intuition. And we systematically devalue that as a culture. We say, why do you believe in astrology? It's so silly. Or like, what do you mean a psycho-spiritual basis to a thyroid issue? That's ridiculous. And the ancient Taoist symbol always appreciated these two things exist in dynamic equilibrium, and they are two equally important sides of the truth. And we just are existing in a state of yang imbalance, where that's what we value. And I certainly knew how to perform yang my whole life. I was taking BC calculus and applying to med school and doing well on the MCAT and talking the talk of rigorous evidence-based academic medicine. And eventually I had to realize that was a performance. And I had silenced within myself the impermissible part, which was my yin intuitive truth. And I'm at this point actually just fully off the deep end, and I embrace it. And I still value objectivity. I value the evidence, but I also don't silence or suppress or feel ashamed of my intuition. And I actually think that we could all benefit by balancing it out and realizing we've been missing half the truth. And it's a different way of knowing, but it's also valuable.
It's interesting to me how we think about the deep end, right? As somehow you've jumped off of something or you're out there in some dangerous place. Whereas, as you're saying, it's like, well, where else would we want to be other than someplace deep? And I'm wondering for you, as you've leaned into your yin energy, something feminine, something powerful, something intuitive, uh, along with yoga and acupuncture, whether there were certain symbols or moments that helped you, because transitioning from a very conventional evidence-based stance, there is a lot of authoritative energy and vibe that comes back. I love it when I find myself like citing some randomized trial. Like, let me tell you, I've got some science behind this opinion, and like that makes it right. And how disparaging we can be, around other evidence, and how biased we are as we look through that. So, but I'm wondering for you in terms of the intuitive in you. Like the other day, I saw a fox, and I think it like walked right up to me, and just stood there looking at me. I've never had that happen in all my life as a country boy. Foxes are in the distance, in the field. They're a fluffy tail, and I'm still processing. Went and drank, then came back and just stared at me. And so I don't know what that means yet, but I'm wondering if there's some moments like that that stick out to you that kind of help show you the way. And I guess in asking you, I'm wondering if there's some little pearls you have for us on how to pay better attention to them.
Let's say this. It was a journey for me. And an early moment was when I was in Bali doing my yoga teacher training, and I was having a healing session. So already, we're in the deep end already. But the healer said, "You're a witch." And I was kind of like, "Excuse me?" And she said, like, "You're a witch, intuitive and a healer with these magical powers." And I was already kind of in a Bali yoga teacher training mindset. So I was primed to receive that in a new way. I wasn't in a white coat on the wards being like, "That's ridiculous. Go away." And so I really tried that on and started to feel my way into that. Next data point is that when I lost my mom, I it felt like a choice. It was, this is the end and it's absolute, and the world is senseless and random and it's intolerably sad. Or I can choose to believe that there's perhaps something vastly beyond our comprehension occurring here. And perhaps she still exists in some form. Perhaps I can still connect to her. So with a heart available to listen for that, I chose that path, and I get a lot of corroboration of that. And the third data point is that I use this with patients. When I'm with a patient now, I'm going super off the deep end, which was not where I was expecting our conversation to go. But I ask for help from guides, and it helps. And I find that I am a more effective psychiatrist when I open myself up to guidance to better help my patients. And what is that if not, it's definitely not evidence-based medicine, but I find that I am more helpful, more attuned. I'm getting pearls of wisdom that are not my own. And to be able to channel that and to bring that to bear in our practice and the work we do, it simultaneously allows you to be more humble and more effective all at the same time. Just to realize that I don't think what's occurring here is quite as simple and straightforward as we think. And the yang and the evidence-based medicine is really dealing in the material reality. And that's great, and that's happening, and it's real, and it's valid. But I don't think it's the whole picture.
I'm just taking that in, Ellen.
I thought we were going to talk about functional medicine,
We can
supplements.
talk about that. Well, I think you and I are also, and as folks are listening, I hope appreciating. Maybe there's a little BTS piece of hour after hour, year after year, week after week, we sit and we listen in a very sacred space to very specific material. People come to us to speak about very, very specific, usually very secret things about themselves and their inner workings. And so there is something that Ellen's talking about that's very resonant with me in my own experience. When you're sitting, and in the first years of becoming a psychiatrist, it felt there was a development of another bandwidth in my brain where I could be in the room, listening, note taking, processing, and then I could be observing, observing the process, observing the feelings in myself, and formulating. It's kind of the way we use it. Right? What's going on? What am I feeling? What are they saying? How am I responding? How does this fit into a pattern? And there are moments when you don't know. And we learn over and over again. It's kind of, at least at Columbia, we got grilled. It's like in these moments you don't think, you associate. You let the mind, you let the intuition guide you. And it was such a hard thing to trust. It feels like when you want to reproduce it or you want to explain it, why'd you say, that you should go get a surfboard and surf? That's a weird interpretation. It's like, what? I saw it so clearly in my mind, this person with the surfboard, and or maybe it's not a good example, but something like that. So learning to trust that intuition is something that also feels like it only comes from being with people. Whether you're a witch or a psychiatrist or a healer or a guru. We only learn about those gifts in the use of them.
And we could talk about that in a purely material way. There's mirror neurons at play. There's attunement and attrainment, and there's association, which is built off of, it's like an AI model. So much data goes into that. What you know about this patient, what you've encountered in your own life with other patients. So we're spitting out a solution based on a million things that are beyond, they're not just consciously accessible. We associate and we have something to offer. And I suppose I'm just adding like one more sprinkle of seasoning to this, which is that maybe there's even something beyond our material data points at play. And in humility, humbly asking for that support, even if it just helps us access whatever was the data that we're associating with in the first place. For me, it puts me in the right stance to get my cerebral micromanaging brain out of the way and to allow what needs to come forward to show up.
No, I really appreciate that. I feel that sometimes when I'm in those other settings, something relaxes because the part of my brain that, the way that dopamine works of like setting goals and achieving them. There's something in the psycho-spiritual world that is sort of not such a great system. It's not like, yeah, I'm going for like level 10 spirituality next weekend, and I'm going to do like 1.5 hours of hardcore meditation and praying, like just with my buds. There's not that same kind of drive, which I find very comforting. But in the sense of one, how quickly we can get settled down when you start just believing in this and tapping into it. Ellen, you mentioned functional medicine, and I want to get into that because I find myself like rooting for functional medicine and functional medicine practitioners, and also bristling at the way a lot of functional medicine talks about mental health. And so you, as somebody who has a foot in both worlds, I'm really curious of what it looks like when it's working. Because my bias is that I feel like there's a lot of meds are toxic, meds are evil, psychiatry's bad, let's take you off everything. And instead, let's give you a lot of supplements and let's do a whole lot of tests. And then I think the part that's I find the hardest, let's kind of weave a mental health-ish set of ideas around the labs we've found. And that's probably functional medicine at its worst. You can say the same thing about conventional psychiatry in lots of ways, in the sense of maybe not the system we'd want. So I think my question is, what's it look like when it's working and it's great?
To me, at the heart, functional medicine is a philosophical stance, which is that someone comes in and they're not feeling well. And rather than thinking, well, what med will suppress their symptoms, you're thinking, what is the root cause here? Let's address it at that level. And to me, root cause can really be two main things: physical imbalance and psychospiritual unmet need. And there's often a combination of the two, where functional medicine loses the plot is when we can't pluck ourselves out of the pill for an ill mentality and it just becomes green medicine. Instead of fluoxetine, we're putting somebody on methylfolate and B12 shots and so on and so forth, and quite a bit more. And I think that all of that testing can be burdensome on a variety of levels. Part of it is that it's expensive, and people are squeamish about needles, but also I just think you usually want to be trying to find the through line to wellness. Like, where are you well? Where is there self-efficacy? Where are you okay? And I think a lot of functional medicine can really drive home a message of you're a patient. Here's all of the things that are wrong in your blood work. Here are all the pills you should choke down every morning and every night and 2 hours after meals. And I think that that can just reinforce a message of I'm sick. And I think that even though there's sometimes a real therapeutic benefit to what you might be taking in supplement form, it has to be balanced with that's not necessarily a healthy message to physically remind yourself of 3 times a day. To me, the paradigm shift around mental health that I appreciate from functional medicine is that we have come of age with the monoamine hypothesis of depression. It says depression is the result of a genetic chemical imbalance, and it's your serotonin, and it's a fixed trait. It's something about you, which implies it's a destiny. Maybe we have some appreciation of the epigenetic aspect of this, but culturally we think I have depression, but that's okay because I can take a pill, it'll raise my serotonin, and then I'm okay. And that narrative works if you're one of the people that are helped by meds. But I've also observed in my practice that a lot of people aren't sufficiently helped by meds. And then that narrative ends up generating a lot of hopelessness and despair because you think, well, I've tried this med and this med and this med. I'm still not feeling better. So I'm just a lost cause. Mm. And that's where I think it's so important to open up someone's eyes to the fact that depression was never a destiny. There's no genetic destiny. There's a few, small handful, but it always has to be considered in context. In functional medicine, we say genetics loads the gun, but the environment pulls the trigger. And if we look at just the evidence-based list of determinants of mental health issues, that list includes how we're sleeping, how we're feeding ourselves, the degree to which we have inflammatory molecules coursing through our bloodstream. Are we moving our bodies? Do we have community, ACE scores, history of trauma, ongoing stressors? Do we wake up with a sense of meaning and purpose? Do we have ritual? Are we being of service? These things matter, and there's something we can do about many of these things. So I'd rather shift somebody's focus away from the fixed trait toward a growth mindset and say, hey, you're struggling and you can feel empowered and hopeful. And we have to figure out, what is this depression communicating to us? Is it physical imbalance? Is it some kind of psychospiritual unmet need? Let's investigate, understand, address it at that level, and usually walk away from quite a lot of suffering.
Thank you for that, Ellen. I'm wondering, with that, as you're kind of thinking, you talk about ritual. I would say that's something that most of us maybe don't, and I shouldn't speak for everybody listening. Maybe I'll have a bunch of ritual, but a lot of folks don't have ritual, especially around some of what we've been talking about. Maybe some of the psycho-spiritual aspects of what you're discussing. And I'm wondering if there are some rituals that are kind of accessible, like good for people who are maybe a little newbies at this, or maybe another way to put it, if you haven't had a psycho-spiritual life through an organized religion, and so the notion of ritual is maybe appealing, but a little bit foreign. I wonder if there's certain ones that you help people with as they kind of maybe take a step into this.
Yeah, ritual is such an interesting, there's a lot to explore in this concept. I mean, I think that culturally, we've just lost a lot of our rituals. They're preserved in more traditional cultures, indigenous cultures. These days, we have weddings, we have white coat ceremonies, we have a few rituals, but we could benefit from more coming of age rituals, grief rituals. And I think that the human brain, we're such social creatures, we're storytellers. And I think of ritual as like a chapter heading. It punctuates moments in life so we can organize it, make sense of it, recognize that we've entered a new phase. And I think one particularly near and dear to my heart is I don't think we grieve appropriately as a culture. I think that first of all, we need to expand our definition of loss. There's death, certainly, but even within that, there's not just death of loved ones, there's death of pets, but then there's a lot of losses that should be grieved. Pregnancy loss, not even conceiving in the first place, miscarriage. And I think that also divorce, also role transitions, job transitions, moving, all of these it doesn't have to be that you stop your life for several weeks, but some ritual to mark, okay, it's not that I'm making a mistake, I'm moving forward into this next phase of life, but I also want to appropriately mourn the ending of this. And I think we are so all or nothing about grief. And I think to just be able to integrate it into our daily lives and say, I'm okay, and this doesn't mean I'm doing anything wrong, but I also mourn the loss of this other potential timeline. And I think that within the grief umbrella, I think we're due for a cultural rebranding around crying. So I think we've really got that one wrong. We think of crying as a weakness, a sign of pathology. When we start to cry, we apologize, and then we try to suck it back in and make it as quick and small as possible. And then we think, like, I did the right thing, I'm sucking it back in. But I think it's the wisdom of our body giving us an opportunity for a much needed release. And we're missing that all the time. The tears are not the pathology, they are the medicine. And we want to get better at crying. We want to make it bigger and more complete and uglier, and to not apologize for it, but actually to take a role in normalizing it, and certainly hold space for others when they're crying, and send body language and facial microexpressions that are sending a message of, you can keep going. You don't have to wrap this up for my benefit.
Yeah, so often we get the pat.
There, human.
Whoa, hey, it's okay. Like, whoa, don't let this. I notice that as a parent a lot of times. There's a way that, like, as you're saying, the tears need to be contained. I appreciate the permission to explore ugly crying. I wouldn't say I'm very good at that, but I've certainly noticed maybe over the last 5 years, I've gotten much better at crying, and I think it's a little confusing, especially for men, or who people who might be aligned with kind of that masculine energy, whether you're a man or not, right? Of kind of containing emotion and not being vulnerable or weak, the idea of ritual around it, I think, is great. I tend to be an early morning crier, and I find that Instagram, like, I write really emotional posts on Instagram that I don't post. Like, my drafts is full of like with all this the Middle East conflict really, really kind of hit me, and I can't really make a video or write about it without crying a lot. And so I'm wondering for you if there's some rituals around, like, that could help me be more in the deep end of the pool with my crying fits.
So everything from Pixar movies are really good at getting your motor running with crying, to psychedelics. And I think that I find that I learned a lot about crying through psychedelic medicine. And at some point, maybe we'll wrap up all the caveats around psychedelics. But I think that when indicated, when appropriate, when in a safe clinical setting, psychedelic medicine, for me, it showed me, and I thought I was good at grieving. I thought I was good at crying. And it took me orders of magnitude deeper into the ability to open that up and to grieve more deeply, and to realize it's not a bad thing. It really felt medicinal. It's a big release. It's a somatic release. It's cathartic, and it's really exquisitely a straight line into our humanity.
We all do it. I mean, we all do it, and we all do it in certain settings, and there's something contagious about it, and there's something that
Yes.
sticks out to us about moments when we see it. Um, it's yeah, find where we can kind of contain it and hold it in until someone looks us right in the eye and with an open heart says, "Hey, how are you? What's up?" And we just can't hold it in anymore, and it comes out. It does show us our humanity.
It's a gift that we can offer to others. It's one of the most like incredible privileges of being a mental health practitioner is to get to hold space for a lot of tears and to actually give people the safety to really cry completely.
Yeah, well, I get to work with a lot of men, and there's a lot of questions around that, and working with someone who's lost a parent in the midst of losing another parent was kind of noting and wondering, I'm not sure that it's is it the medicine I'm on? Is it where I am? I feel I should be crying more. And in asking about it, it kind of got to this point where there wasn't really a time or space or ritual around accessing that. And I think for a lot of people, there's just a notion that tears are symptoms. And I love what
Yeah.
you said, that tears are our medicine. They're a kind of a climax of sadness in a little way, and the expression of them does something to us, because it does feel to me. It feels a little bit to me like we have food poisoning, and especially as a physician, like you get that little in the back of your throat, and you're like instantly. There's no like, oh, I wonder if it's like, wow, I got food poisoning. I wonder what that was, and then you feel it in your tummy, and like you got to get it out, right? And you can fight it, but eventually, like it's sometimes I feel that we're really that way with our tears, right? There's this like big wound, and we're like trying to move away from it or move through it or get past it, and we just have to kind of sit and let it just wash over us and sob about it.
I mean, we're even like that with our food poisoning. It's outrageous, really, that we think of the releases as the symptoms. And someone might take Imodium, they might take an antiemetic. They think, I shouldn't throw up, that's the problem, or I shouldn't have diarrhea, that's the problem. But that's actually the wisdom of your body ejecting something that's not serving you. And I think that in naturopathic medicine, maybe Ayurvedic medicine, there's a principle around not suppressing the body's urges. It knows, don't suppress a yawn, don't suppress a cry, don't suppress a fart, let it out. And I think that you're absolutely right that it's harder for men. We have so much cultural messaging. Both genders get their fair share of some pretty rough cultural messaging.
No, I mean, I don't. I think I don't mean. I think that I think it's harder in different ways, because I think for women, particularly, in certain settings, when you're, in motherhood or in a professional setting, I think it's also very, we can say that somehow maybe the tears are more appropriate, or they there's a gendered acceptance of it, but like, I think it's also incredibly hard, right? Because there's that notion of, you're being too emotional, is what I've heard lots of my
For sure.
female patients say. It's like, I don't want to be that. I don't want people to, I don't want to be seen as having that much emotion.
You're absolutely right. And the last thing I would ever say is that women have an easy path through this life. I think that uniquely around crying, I love the work of Liz Plank, who has a book called For the Love of Men. And she really talks a lot about, I love to deconstruct both toxic masculinity and misogyny, and to really understand, like, we're not just going to conclude, therefore men are bad or therefore women are bad. It's really, well, why has this come to be? And I think that toxic masculinity has a lot to do with the conditioning that tells you wear the straitjacket of you can't be weak. And this is what's valued in you. And so that doesn't leave a lot of space for tears. And I think, to your patient's point, SSRIs do play a role. I do find that they can blunt the extremes of emotion, and someone can be less able to access crying when they're medicated.
Yeah. I think it's also, per this recent study looking at meds versus CBT and how they work, that's a little bit the point of them. And I mean, and I think that quote could be, that could be taken out of context, but that when people are uncontrollably sobbing, not able to sleep, having horrible, ruminative suicidal thoughts, and there's a diminution, there's less tears, fewer thoughts, more sleep, right? Fewer symptoms. It's an incredible relief in that acute phase. When, again, as you said, for the people who meds work, which is, let's say, half, 60% ish. The the I think kind of remarkable part of it is how that then is the kind of the whole trajectory of the treatment. Like then the mood is better, so the disease is cured. And we all know that's not how it goes with our mental health. And so I think using the medicines in an appropriate way to help people with relief of symptoms. This patient was really interesting in part because in the discussion of should he or shouldn't he stay on medicine over the next, we kind of made this decision over a couple of months when patients are, considering, what they're going to do about medicines. And there'd been a little intentionality of keeping him a little less emotional. A lot of
Yeah.
stress coming on, a lot of triggers with a family member that was ill, doing well, right, and having been feeling a lot more sadness. And so there's I appreciate what you say, that there is, there certainly is a blunting of affect for some patients. And just like for some patients, there's a real opening of how they're feeling as the depression lifts. And I think it gets so confusing because it's such an individual response that you and I both have talked to people who are like, Zoloft was the worst thing I ever tried. Yuck. And other people have been like, thank goodness this really saved my life. I think it's where we want to make this very personal, individual thing, a little too generalizable.
Yeah. It's often a bridge, and it's just hard to predict when it's going to be this or that. Interestingly, for anyone who has experienced a blunting of their emotion while on medication, I have observed that in the medication discontinuation process, it's almost as though there's a recapitulation. You get a second chance to go through the big emotional catharsis that might have been blunted while you were going through something.
In a setting, part of, in some models of this is people stabilize, form alliance, find a place to do safe and good work. Some more of that can kind of come out, get processed. I think it's where people have variable journeys in terms of meds, therapy, and the work that they're doing. Ellen, I wanted to just ask a couple of things around supplements and around food, because so many people listening do have anxiety. And as much as I hope they'll find great mental health evaluation and clinicians, some people want to look for other solutions, or they aren't in communities where those are available. And I'm wondering if there are kind of specific foods and or supplements that you feel really make a difference when it comes to anxiety and the management of anxiety.
Yeah. And those two questions have a lot of overlap, because the longer I do this work, the more I've substituted supplements with foods. And I think, supplement wise, I used to put people on all kinds of stuff. These days, I try to narrow it down mainly for anxiety to magnesium glycinate at bedtime. I think that's generally helpful because most of us are deficient because our food is, because our soil is. And so supplementing with a little magnesium glycinate at bedtime helps with sleep, helps with anxiety, helps with a number of other biochemical.
It's kind of a milligram that you start with, or kind of like range. Some people worry a little bit about diarrhea if it's too much. Where do you kind of?
I have most people take the capsules, not the tablets, because it can be kind of a chalky, hard to swallow pill. And the capsules usually come in 120 milligrams. So start with one, see how that goes. Some of my patients end up taking two. So 240 milligrams at night is their dose. I've had patients who top out at 600 some milligrams. They are usually the people with severe menstrual cramps, migraine headaches. It's sort of, I think, repleting a bigger deficiency for them. But if you start to get loose stool, that's usually a good indication that you want to ease off. And you can take breaks from this. And if you want a gentler way to replete magnesium, an Epsom salt bath is a great way to absorb it through your skin.
Epsom salt bath. I can get magnesium through my Epsom salt bath.
Absolutely.
Drinking my Gerald Steiner seltzer, which also has a fair amount of magnesium.
That's right. That's right. It's an affordable luxury.
Hope Gerald Steiner is thinking about funding, sponsoring this podcast episode.
Yes. Brought to you by the effervescent Gerald Steiner seltzer.
So more magnesium is a supplement you've leaned to. Where do you sit on the omega-3 debate?
Okay. So I think that it's so complex, and I basically have my patients keep a jar of Rosita Foods extra virgin cod liver oil in their fridge, because I do think sourcing is messy. I do think that some of the companies lack transparency. I do think it can be rancid. I do think it can have mercury. I think there's a lot of potential pitfalls with it. I trust Rosita Foods, but I don't want my patients taking it every day. I want them to maybe have a teaspoon in the morning in the winter if they're struggling with seasonal affective symptoms. But I also want people to take breaks from it and to kind of use a little bit of an intuitive compass to know it's a good time to take it. It's a good time to take a break. Foods, we could talk about that alone for the full podcast. You could write multiple books on this topic, but I think that suffice it to say, the message we really need is that good mental health is a reflection of healthy brain function. And the brain, a physical organ, a piece of flesh, requires certain raw materials to function properly: vitamins, minerals, nutrients. And there's no real way around. We have to get it from food. And I think that we've got such a national eating disorder where we think about food in all the wrong ways. And I wish we could almost just have a consultation with our great, 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 great grandmother and just have her swoop in and say, eat these foods. Because I think she had an appreciation for nutrient density, for eating a diversity of different foods, for knowing what a real food is. And I think that's where we've gotten so deranged, and we have all these conflicting media headlines that are dizzying to the layperson. They're dizzying to the physician. And then we end up thinking, okay, should I eat egg white omelets? No, now maybe the dietary cholesterol is not the villain. And should I be eating monounsaturated fats, or should I be eating vegetable oils, or should I be avoiding this? And I think that we've been told fat was bad. We've been told dietary cholesterol was bad. We've been told calories in minus calories out is all that matters. I think all of that has been misguided. We have to do a lot of unlearning. But to simplify the conversation, I think the compass that is most useful is generally, when possible, err on the side of eating real food. Generally, when possible, err on the side of avoiding fake food, and do all of that with a light grip, because we are living in the modern food landscape, and this is an uphill battle. And if we start to get obsessive about it, or we fear food, or feel like our bodies are fragile, or meal prep becomes a part-time job, that's counter-therapeutic, not to mention if we're declining dinner party invitations. So we need to strike the right balance where this is done with ease and convenience and affordability and deliciousness, and always through a lens of self-love.
It feels like that really applies overall to this idea around mental fitness, where so often we encounter people being really harsh on the self. I think discipline and being disciplined has gotten really, there's something about the way that's gotten emphasized that's gotten incredibly harsh. And so I really appreciate what you're saying, that as we're cultivating mental fitness, to have a kindness towards the self, to have some patience, to understand, eating more beans and greens to get more magnesium is a win. But there are times maybe when you're traveling, or maybe you're someone who has migraines, and extra magnesium really reduces the frequency, where, there along with the beans and greens, some other enhancements. Are there foods that really made a difference for your anxiety?
Yeah, I think that the biggest one for me, and this is individual, but I actually really did need to go gluten-free. That's my truth. My mom had celiac disease. I have the HLA-DQ2, whatever risk factor, and that was night and day for me, from being always in pain and constipated and foggy and depressed, to just being a normal functioning human. So we don't all need to go gluten-free, but if you have reason to believe it's causing a problem, it can be worth doing a trial off of gluten, which is easier said than done. And it's hidden in things like soy sauce, and it's hidden in conventional oats, and it's delicious and addictive, and it's sad to part with it. And I think that there's even cost, there's risk to going gluten-free if it's not necessary for you, both in the orthorexic tendencies that it can conjure, but also in maybe we even make it harder to tolerate the gluten once we come back to it. It's tough to say. So I think that you don't want to approach that cavalierly.
Was it clear to you in the sense that, it's an idea you heard about and finally you tried it and you got a lot better, and then you had some gluten and anxiety comes back quite quickly?
Yes, and I've run that experiment a number of times. and also I interestingly tolerate gluten in Europe. But I don't tolerate it in the United States.
Everybody's always confused about it and debating, and we hear that a lot and wonder, is it the lifestyle? Is it the gluten? Is it the genetics of the wheat? I've seen all kinds of debate on that. The one that doesn't seem debatable, at least since we're talking about some evidence, See, I get all authoritative. Since there's a study, Ellen, let me tell you,
Yes.
the patients who have gluten sensitivity, once they reduce gluten, they have less anxiety. It's because there is a trial. It was about patients with non-celiac gluten sensitivity. I think it was the 80% of folks in the sample had pretty severe anxiety, and as they adopted a gluten-free lifestyle and diet, they it went down to sort of the rates of the control population. And the gluten thing is certainly something folks have heard about for about 20 years. It's still to note there are 1 million Americans who have undiagnosed celiac disease, right? This isn't even like the debatable sensitivity part. This is like the full-on autoimmune disorder or the immune disorder to gluten. And so, or to gliadin. And so, if you find yourself having anxiety, bloating after you eat, in some ways I find that really hopeful because you see a trigger. And anytime we see a trigger, I mean, like my ears perk up as a clinician. As soon as I see a trigger, it's like, okay, now we're getting somewhere. And when we know about a trigger, we begin to really understand what happens, what causes it, what situation we're in, how to make it, minimize the damage or challenge. So, yeah, I appreciate you sharing that, and also how complex it is.
Where there's a trigger, we can do something about it. And I love that you brought up the undiagnosed celiacs. Even diagnosed celiacs, I've noticed that I've come across a handful of people who know they're diagnosed with celiac and they are doing their best to be gluten-free, but they know they're not 100% gluten-free. And that's like a topic near and dear to my heart because it really can contribute to premature death. And to live in that degree of systemic inflammation, it increases risk of, I believe it's colon cancer. And I want people with celiac disease to take it seriously and to really actually be 100% gluten-free. And the folks with non-celiac gluten sensitivity to not believe the message that it's all in your head. I mean, there's something real there, and we don't yet know how to point biologically to what's going on there. And for a lot of folks, it does vary by the soil you're standing on. I think it's a lot of factors. If I had to pick one beyond like the hybridization of the wheat or the lifestyle or the processing of the, how the bread is being prepared, I think if there's one lion's share factor, it's probably the pesticide Roundup, which we use with reckless abandon here, both in the growing phase, but also just before harvest as a desiccant. So we're coating the outside of the wheat in a way that's then incorporated into the later bread product. And Roundup, the active ingredient is glyphosate, and that is creating dysbiosis, and for genetically susceptible folks, also intestinal permeability. I think that's such an interesting 1-2 punch, because to eat gluten with an agent that creates leaky gut, intestinal permeability, it's like you're creating the conditions to develop antibodies against something, because you're saying, eat this food, leak it into your gut, and then your immune system sees it and says, that doesn't belong here, generates antibodies, and then you've developed this intolerance. But I think about the anxiety effect with gluten as multifactorial. Having gut inflammation compromises our ability to manufacture GABA, the neurotransmitter that helps us feel calm and okay. To be systemically inflamed communicates directly to the amygdala and tells us we're under threat. And even for some people, I think there's a molecular mimicry effect of how these anti-gluten antibodies attack the thyroid and perhaps stimulate some periodic state of relative hyperthyroidism while also damaging the thyroid, creating a state of relative hypothyroidism. And that can clinically look a lot like alternating between states of anxiety and depression.
Along with gluten, I'm just wondering some of the food moves. I mean, I've seen you reference, looking out for caffeine, of course, and theobromines in chocolate. And we've been talking a little bit about gluten. My sense from your work is that promoting a more whole foods, Mediterranean style type diet. I'm wondering if there are other specific changes that you find with your patients or with yourself really help with anxiety.
Yeah, I like my patients to keep their blood sugar stable, especially people who struggle with anxiety. I think that we're all on the modern American blood sugar roller coaster because our diet is coffee drinks that are secretly milkshakes and rosé all day. And so when our blood sugar crashes, it generates a stress response, and that can feel identical to anxiety. And so that could be through a blood sugar stabilizing diet with a little bit more healthy fats and protein, a little bit less refined carbohydrates and added sugars. But a lot of my patients use something like almond butter or coconut oil, and they take a spoonful. just to give themselves a safety net of stable blood sugar, which can be helpful before you brush your teeth at night. It can be helpful if your kind of blood sugar tends to crash every day, like 3 p.m., and you're on a mad dash for sugary snacks. Caffeine, I'm really evolving on my stance around caffeine. I've always thought it's not an inherently bad substance. We just have to be real about the bioindividuality. And one person might be a rapid metabolizer and they can really do what they please with caffeine. But someone else who's a slow metabolizer, who's sensitive to caffeine, I think we just have to be aware of the fact that America always does this thing where we think something's good, more is better. And we really do that with caffeine. And I was in Italy and I was like, maybe I'm a coffee drinker again. And I drank cappuccino every day. And I came back here and I didn't tolerate the coffee again. So I asked the barista, I was like, is there a difference? And he's like, well, in Italy, they pull a single shot of espresso. And here, just by default, we pull a double shot. And so we're just twicing our caffeine consumption and everybody's anxious. And so I think that maybe you just order your single shot cappuccino. Maybe you continue the coffee habit, but just think about timing it such that it's maybe 90 minutes after waking. So it gives you a kind of nice curve of being caffeinated during the workday, but then you're coming down not in the middle of the afternoon, which makes it tempting to get a frappuccino at 3 p.m, but you're coming down toward the end of the workday and avoiding caffeine in the afternoon so that you're not creating the conditions for a less restful sleep. And then I think that fermented foods have a role in helping ensure a diverse ecosystem of beneficial bacteria in the gut. Bone broth has a role both in how nutrient dense it is, but the fact that this collagenous matrix helps heal leaky gut lining and that can soothe inflammation. I love for my patients to eat organ meats, and I know they've fallen out of favor in the West.
You have a favorite organ meat recommendation, Dr. Vora?
They all taste gross, but the one that's easy is chicken liver pate. And to just get that from a good butcher and then have a spoonful every few days. And that's like Mother Nature's multivitamin. And it really helps round out our nutritional scavenger hunt.
I love the liver recommendation. I like recommending clams personally just because so few doctors are these days. Dr. Vora, it is such a treat to speak with you and to think about really the best of holistic medicine, where you're drawing on some ancient wisdom and intuition and encouraging us all to tap into that more, to have more ritual, to have more psycho-spiritual growth, to really think about the roots of our anxiety and our responses to our anxiety. And I was so grateful to see your book come out, The Pandemic, but also just to have known you since you're a medical student and I was a resident. All of us in healthcare, we have those relationships, people where our paths cross and the world is round and we meet again. And so it's just an absolute delight to have you as a colleague and a friend, and to see all of the wonderful messaging and work and that you're doing to help us, just be more responsible with ourselves and these wonderful brains that we have. And to have a life of mental fitness, right? To really be active about it. I think that's one of the things that's so clear to me in your messaging. And I don't mean to call it your messaging, but in your message, right? That you're not an acupuncturist and a yoga teacher and a psychiatrist if you're not really walking the talk in a certain way that few of us are. And I really appreciate that inspo, and thank you for it. And I love what you bring to the movement and how you open up our arms a little wider, it feels to me, in psychiatry, to really invite people in a very loving and tolerant way. So thank you for that, Ellen. Thanks for coming and sharing your time and your wisdom with us. And wonder if you want to leave us with a message, something inspiring. When these episodes drop, I ask that everyone really take something from it. Take something, actualize this message, right? And I'm wondering if there's a message you can leave with us with that has inspired you in your own mental fitness.
Well, thank you so much for having me today. And I think if there's a single message, it's that our mental health symptoms are communications from the body. Something's out of balance physically, or maybe we have an unmet need. And if you need any advice for what to explore, look first at community, which I think is a very common unmet need and a very potent factor in our mental well-being, and to make sure that we're prioritizing community. And I've just been thinking about that fox that stopped and looked at you. And I'd be so curious to hear what you make of that. But I think that this pairs with also just trust intuition and when something salient or uncanny happens, to pause on that and stay curious and just listen for what might be coming through in that moment. I think that fox was up to something, but perhaps he's just recognizing that you're doing good work here, spreading a really helpful message. And this is medicine for people. So thanks for doing what you do.
Thank you, Ellen. We'll have to get back on and talk about psychedelic medicine. And we now here in Spruce Mental Health in Jackson have been guiding ketamine-assisted psychotherapy and ketamine-assisted group psychotherapy journeys, and trying to be responsible with the new evidence that's come out around a variety of compounds, but also with what is legal and accessible to us. I find the mental health community is really eager for more options, but also in some ways vulnerable, as a lot of people have high hopes for how quick things can happen, which, as you and I know, we never want things to go slowly, but a masterpiece of mental health does take a little bit of time. So we'll have to have you back on and talk more about all of those exciting cutting edge issues. Everybody, thank you so much for your time. Please check out Dr. Ellen Vora's book, The Anatomy of Anxiety. She's got a great Instagram feed as well, where she'll remind you to get into the sun, not something many doctors will do while you're enjoying your pate. And please check out lots of great info and resources on our website as well. And most importantly to us as psychiatrists, something stuck with you in this talk. It always does. One line, one word, something Ellen or I said. And I just ask you to really hang on to that. Hang on to that and do something amazing with it for yourself, for your community over the next few days. And until then, everybody, I'm Dr. Drew Ramsey. Thank you for making the mental fitness revolution happen. It happens one moment at a time for all of us, one little decision, one behavioral change, one moment of connection. And so I look forward to the next one with you in the next episode. Until then, take care of each other and be safe. Thank you so much.